The day of surgery for an abdominoplasty is you will come into hospital well educated about what to expect, and there's a fair bit to expect. So abdominoplasty is an operation which has a significant recovery. Lots of the operations we do as plastic surgeons have fairly long procedures, but the recovery is really no big deal. It's not very sore and so on. Abdominoplasty, if a muscle repair is part of it, is a substantial procedure. So all the pain-killing drugs you get are constipating, and they can make you feel sick as well. So we start the process of a good experience with abdominoplasty from before the surgery, and we recommend, and you'll get information on all of this, that you basically start taking laxatives before surgery because you don't want to be constipated. At surgery itself, you'll be seen by the anaesthetist beforehand. There's nothing particularly you need to do. If you have a skin overhang, I recommend that you get some medicated soap and use it for 1 week pre-surgery, but not longer than 1 week, so that we reduce any bacterial load. If there's no skin overhang, you don't need to do that. Once you're in the operating room, the anaesthetist will anaesthetise you, and that's something you probably won't remember. Then we put a urinary catheter in. So you wake up with a catheter, you'll have an IV in, and at the end of the operation, I use 2 drain tubes. So the drain tubes essentially go above the muscle but under the skin, because that skin's been lifted up, so there's a potential space there. And then we put a compression garment on you at the end, and you'll have stockings to reduce the risk of DVT or leg clots. So you'll be kind of trussed up with drains, drips, oxygen mask, urinary catheter. I put 2 little tubes in and start the pain control or pain management process intraoperatively. So those little fine tubes, about 1.5 millimeters across, are threaded into each muscle, each side of the muscle repair, and they hook up to a local anaesthetic pump. And what that will do is pump local in very slowly and in a controlled dose to numb the muscle repair, and that makes a tremendous difference. So you wake up pretty numb and usually not terribly sore. As you come to grips with this all, you'll be given more pain relief as you need it. Our aim is not that there's no pain, our aim is to manage it very well. And the first day after surgery, you'll need significant pain relief. You'll have the local anaesthetic going in, and you'll have a urinary catheter and a drip, and we'll encourage you to drink well. On the first day after the operation, and you're usually in hospital either 2 nights or 3 nights, depending on the size of the tummy tuck and the individual. But on the first post-operative day, we really get you moving. You've got your wits about you, and we try and get you onto oral analgesics or oral painkillers. And these are strong painkillers such as endone or tramadol or oxycodone or Targin. And some people really don't react well to those. Usually we can find a combination that works fine. Once we've got you on those with controlled nausea so that you can drink well, then we turn off the local anaesthetic and then manage you through that process of transferring to oral medications. Then the next day, the catheter comes out, the IV comes out, the drains come out, and the pain pump comes out. And typically, you're in a compression garment, kind of good to go. You're on oral analgesics, you're controlled, you're having something to eat. I don't want you to eat too much at the start because it makes you feel sick. But you're having good fluids and not going to get dehydrated and nibbling away at stuff. And once you're in that position, you're good to go home. And that usually is after 2 nights in hospital, sometimes 3. So when you go home, you should be able to be self-caring, able to go to the bathroom, get in and out of bed, and be comfortable. Which is to say, you'll need painkillers to be comfortable. You need somebody at home with you for the first few days. And you don't want to be looking after anybody else. You can start looking after the rest of the family, if there is one, in a week or 10 days after the surgery, but you need some help for that time. Essentially, that's the process. So we do it all the time. It's a stepwise process. Having an abdominoplasty should not be an awful experience, but it needs careful attention for the post-op management of it to be a good experience.